for a nearly empty ICU. With less than 1,000 confirmed cases in Kenya, head doctor Dr. Isaac Adembesa says the admissions have been few so far. Roughly 200 COVID-19 patients have been treated here. 7 of them needed intensive care. But the numbers are rising.
We have a 24-bed capacity. That is not enough. If we get more than 24 patients requiring mechanical ventilation, then we are definitely going to have a problem.
A chronic shortage of life-saving equipment in the region has doctors like Adembesa bracing themselves, while the World Health Organization and private entities race to deliver much-needed equipment across Africa.
As a hospital, we had requested 400 more ventilators. We are yet to receive any so far.
But there's one thing he says he's thankful the hospital does have.
We are lucky we have an oxygen plant which generates oxygen. I know quite a number of hospitals rely on oxygen cylinders, and that can really be a challenge, especially if you get huge numbers of patients at once. I can imagine maybe the far-flung areas of Kenya, they have to travel several kilometers to get access to these cylinders.
Kenya's government has vowed to mass manufacture ventilators to meet the demand. But Dr. Wangari Siika, an intensive care specialist at Aga Khan University Hospital, says sourcing equipment is only part of the problem.
The bigger problem is the human resource, the technical know-how to operate the machines and operate them safely, to guide the care on a day-to-day basis, hour-to-hour basis.
Critical care as a formal speciality is fairly new in Kenya. Kenya has about 20 intensive care specialists countrywide, most of them in the capital, Nairobi. Much of the country's critical care needs have fallen in the hands of anesthesiologists, of which there are less than 200 in a country of about 50 million people.
What we could do, as we say, is to network and introduce what we call tele-ICU, telemedicine for intensive care units, where I'm in Nairobi and I can have a number of ICUs that contact me, tell me we received such a patient, we've done this, I say, oh, try this, give me feedback in an hour, and we keep doing that until ultimately they are able to do what we are able to do.
And her team is hopeful, but they are spread thin.
If we have a situation where one person can take 3 or even 5 ICUs around the country amongst the 20 of us, I think that would give us some good results.
Around the world, COVID-19 has revealed absences in health systems as hospitals struggle to cope with the outbreak. In Kenya, it has shown the gap in critical care.
There is a role for the intensivist, not just